What is laparoscopic hysterectomy? So laparoscopic hysterectomy is a type of hysterectomy where we do the hysterectomy, that is the removal of the uterus and the cervix through laparoscope. It is a minimally invasive procedure. That means there are small holes which are done on the abdomen and through which the surgery is performed using specialized instruments like laparoscope, shearer, grasper and needle holders. So where the advantage is that it is a minimally invasive procedure where there is no large cut on the tummy, and second thing is there will be minimal blood loss during the procedure. Third thing is that there will be shorter hospital stay because the patient will not have much pain and there will be faster recovery of the patient. So these are the advantages of doing a laparoscopic hysterectomy. The indications for laparoscopic hysterectomy could be fibroids, prolapse uterus, adenomyosis and endometriosis. Also in gynecological cancers, the hysterectomy is indicated. But the laparoscopic hysterectomy is more popular in cases of benign conditions than in malignant conditions. So in laparoscope, what we usually use is the 10 mm laparoscope, that is an instrument which has a camera and a light source which goes into the patient's abdomen, and with the side ports which could be 2 to 3, and with this we try and do the entire procedure for separating the uterus from its attachment, and we bring the uterus below or from the vaginal root for the extraction of the specimen. So laparoscopic hysterectomy is a major surgery. It is done under usually general anesthesia, and the patient has to be admitted for a very short period of 12 to 24 hours depending on the complexity. So how do we decide to place the ports? So the placement of these ports depend mainly on the gynecological condition, especially when there is the difference in the size of the uterus. When the uterus size is bigger, then the port placement will slightly differ. And it also depends on the surgeon's comfort. So the ports can be on the same side of the abdomen. It could be on the other side of one port, can be on each side of the abdomen, or it could be like there could be a central port which is fixed for all cases. So the patient's benefit would be that the pain would be very little after the procedure and they will recover and get back to their routine very quickly after a laparoscopic hysterectomy. So again, laparoscopic hysterectomy, as now it is very popular that more and more patients opt to do the laparoscopic hysterectomy. It requires training and skills of the laparoscopic gynecologic surgeon, and the learning curve is very steep for laparoscopic procedures. So this will require instruments, infrastructure, good assistance, good OT, where it can be performed safely. Laparoscopic hysterectomy is a very safe procedure in good hands, and the patient has to stay in the hospital for a very short duration, and the recovery is also very quick. If you have a choice between laparoscopic hysterectomy, abdominal hysterectomy or vaginal hysterectomy, obviously laparoscopic hysterectomy has much more advantage when it comes to conditions like endometriosis, adenomyosis, when there is large prolapses which has to be fixed through the abdominal route, and also in cases where the access to the pelvis is much better because of the magnification that the laparoscope will provide, and also because of the better access to see the structures which are deep in the pelvis. Laparoscopic hysterectomy can be 3 types. One is laparoscopic assisted vaginal hysterectomy, where we remove the uterus from above up till the uterines, and from there on through the vagina we try and separate the uterus from its attachment through the vaginal route, and the entire specimen will be removed through the vaginal route. It could be a total laparoscopic hysterectomy where the entire procedure of removal of the uterus is done through the laparoscope, only the specimen is retrieved through the vaginal route. Or it could be a laparoscopic supracervical hysterectomy where we remove only the uterus which is above the cervix and we leave behind the cervix, but this is not a very common procedure that we do. The commonest among these 3 is total laparoscopic hysterectomy, where the entire procedure is done through the abdominal laparoscopic method. So discuss with your healthcare professional or your doctor about the benefits and disadvantages of laparoscopic hysterectomy, and then take a decision as to whether this is the one which is suitable for you. Thank you.